Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What does a tick bite look like? Pictures and when to see a doctor. A tick bite typically appears as a small, red and itchy bump. In some cases, the tick might still be attached. Tick bite pictures can help you identify symptoms of tick-borne illnesses. For example, if Lyme disease is present, a bullseye rash may form around the bite. Meanwhile, the rash associated with Rocky Mountain spotted fever, RMSF, is more blotchy and widespread. /r/n/r/n If you find a tick on your skin, you need to remove it safely to prevent infection. Improper removal can cause part of the tick's mouth to break off and remain embedded in your skin, increasing the risk of tick-borne illness. /r/n/r/n If you develop a rash around the tick bite, flu-like symptoms, or suspect the tick was attached to your skin for hours or longer, call a healthcare provider for an evaluation. /r/n/r/n Reproduced with permission from DermNet and Raimo Suhonen dermnetnzorg 2023. /r/n/r/n Not everyone develops the same reaction to a tick bite, and some people may not experience any visible symptoms. /r/n/r/n Tick bites can look different among individuals but may have some of the following characteristics. /r/n/r/n A rash following a tick bite is not always a sign of tick-borne illness. After being bitten by a tick, some people develop localized allergic reactions to the bite, such as itching, swelling, and redness in the surrounding area. These mild allergic reactions typically resolve within a few days. /r/n/r/n Certain types of rashes are more indicative of tick-borne illness. However, it's important to note that not all tick bites result in a rash, and the absence of a rash does not necessarily mean the absence of a tick-borne illness. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Reproduced with permission from dermnetnzorg 2023. /r/n/r/n About 70% to 80% of people infected with Lyme disease develop a bullseye rash known as erythema migrans. The rash is characterized by a central red spot surrounded by a clear area and an outer ring of redness. /r/n/r/n This rash typically appears within 3 to 30 days after a tick bite. It often starts as a small, red bump or a solid red expanding rash that gradually forms a circular or oval-shaped pattern. The rash may have a red outer ring, a clear center, and can grow larger over time. It can expand to 12 inches or more across. /r/n/r/n Other signs of Lyme disease to look out for include, /r/n/r/n Seek medical attention if you notice any of these signs and live in an area known for Lyme disease, even if you never saw a tick on your skin. /r/n/r/n Southern tick-associated rash illness, STARI, is similar to the rash caused by Lyme disease. However, it typically has a less distinctive bullseye pattern. The rash is also smaller, expanding to no more than 3 inches across. /r/n/r/n A STARI rash typically appears within 7 days of the tick bite. It looks like a red, expanding rash around the site of the tick bite, occurring within a few days to a week after the bite. The rash may be circular but tends to have a more irregular shape. /r/n/r/n The type of tick that causes southern tick-associated rash illness is the Lone Star tick. These ticks are most common in the southern United States, where Lyme disease is rare. /r/n/r/n Other signs of STARI include, /r/n/r/n Rocky Mountain spotted fever rashes usually begin as small, flat, pink spots or blotches that gradually spread and merge over time. They often appear on the wrists, ankles, palms, soles, and forearms, and can sometimes become more widespread. /r/n/r/n The appearance of the rash can vary significantly, and individuals who do not develop a rash or exhibit an unusual rash are at a higher likelihood of being diagnosed incorrectly. /r/n/r/n Other signs of Rocky Mountain spotted fever include /r/n/r/n left untreated. Rocky Mountain spotted fever can lead to serious complications, including nerve damage, hearing loss, partial paralysis, and rarely, death. /r/n/r/n Tick paralysis is a condition caused by a toxin in tick saliva that disrupts nerve and muscle function. This can only occur if a tick attaches to the skin and feeds. /r/n/r/n The initial symptom is weakness in the arms and legs, which usually appears 2 to 7 days after the tick attaches. As the condition progresses, the person may become unable to move their arms and legs. /r/n/r/n Symptoms of tick paralysis usually resolve within hours after removing the tick. But if the tick stays attached, the paralysis can worsen, potentially impairing speech or breathing. /r/n/r/n While tick paralysis is most commonly observed in children under 16 and adult men, it can affect individuals of any age who are bitten by a tick. /r/n/r/n Key differences between a tick bite and a bug bite include /r/n/r/n If you live in an area where ticks are commonly found, it's a good idea to check your hairline, armpits, and other body areas where ticks can hide after spending time outdoors. /r/n/r/n Once a tick bite has been identified, it is important to take appropriate measures for treatment. Follow these steps recommended by the Centers for Disease Control and Prevention, CDC, /r/n/r/n After using tweezers to remove a tick, it's important to wash and sanitize them thoroughly. Wash the tweezers thoroughly with soap and water or rubbing alcohol, then submerge them in boiling water for at least 15 minutes. /r/n/r/n After removing the tick with tweezers, take a close look at the tick bite. If you still see a tiny black dot in your skin, the tick's head may still be embedded. Use the sanitized tweezers to try and remove any tick remnants left. If you aren't sure whether the whole tick is gone, it's best to have the bite checked by a healthcare provider. /r/n/r/n The CDC advises you to consult our healthcare provider for guidance if you have a tick bite that is not improving. You should also see a healthcare provider if you suspect a tick has been attached to your skin for hours or longer. /r/n/r/n Depending on the situation, the CDC reports that a single dose of the antibiotic doxycycline after a tick bite may reduce the risk of Lyme disease. It is worth discussing this option with your healthcare provider if you reside in an area where Lyme disease or other tick-borne diseases are prevalent. /r/n/r/n Remain vigilant and monitor your health for any symptoms over 30 days after noticing the bite. It is essential to contact your healthcare provider if you experience any of the following symptoms. /r/n/r/n The treatment for tick-borne diseases is typically based on your symptoms, history of tick exposure, i.e. having a tick bite in the past, and, in some cases, blood test results. Most tick-borne diseases can be effectively treated with a short course of antibiotics. /r/n/r/n Most tick bite rashes that are treated with antibiotics tend to resolve within 3 weeks. In the meantime, the following tips may help relieve rash symptoms like itching and inflammation. /r/n/r/n If you live in an area where ticks are common, or have found a tick on your skin, contact your healthcare provider at the first sign of a rash or other symptoms of tick-borne illness. /r/n/r/n The quicker a tick bite rash is identified, the faster it can be treated. Prolonging treatment for a tick bite rash increases the risk of more severe symptoms and complications. /r/n/r/n If you find a tick on your skin, use tweezers to grasp the tick as close to your skin as possible and gently pull it off without squeezing or crushing the tick. After properly disposing of the tick, wash the tick bite area thoroughly with rubbing alcohol or soap and water. /r/n/r/n Most tick bite symptoms, like rash, fever, and muscle pain appear within 30 days. Watch the tick bite area closely during this time, and contact a healthcare provider at the first sign of tick-borne illness. /r/n/r/n Identifying a tick bite quickly is vital to minimize the risk of potential tick-borne illnesses and get timely treatment if necessary. Remember, if you have any doubts or experience unusual symptoms, don't hesitate to seek medical advice. A healthcare provider can offer essential treatment to manage potential tick-borne illnesses and their symptoms. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.